Certainly the digital revolution allows us to do measurement far, far better than ever before. It's not fair to say, though, that the poorest are connected up to the internet and then you're ever going to get any data from them. You'll get the most biased sample you can imagine. The poorest 2 billion are nowhere near the internet. And so the infrastructure you build, the primary health care center can be hooked up, the school can be hooked up. And we have lots of pilots of these things. Even the data in the UN system is, very slow to arrive, and in some cases not that accurate. For example, in the agricultural space, we can now use satellite photos and visual recognition to get much better data that's actually still actionable during a growing season than you've ever been able to get out of the standard statistical systems. Even numbers like GDP, the way they're measured in African economies is very, very wrong. And so you get these weird adjustments, like Nigeria's about to go up by 60% because of that. There are surveillance systems that can work and get you real-time data. In the case of polio, we've had to double down on that, and now we're using those systems also for routine immunization. And it's an amazing system when it works like it is with this particular approach.
Well, can you walk us through that? Because you had a choice at one point to either pull back from polio or double down. What was the logic behind, doubling down?
Well, polio, the campaign started in 1988 with Rotary and other partners. We were not involved. We got involved in about 1998, and it looked like the cases would end by about 2002. But around the year 2000, they stopped going down. They had about a decade where, because of bad rumors about the vaccine, difficult execution in India, they stayed the same. And so in 2010, we decided to really intensify India and see if it could get done. In fact, the last case, we didn't know it at the time, but was January 2011. And so we built a new 6-year plan to get the final countries, which are Pakistan, Nigeria, and Afghanistan. It is extremely measurement driven, and that's one of the big changes from the way things were going in the past. They used to get pretty flaky monitoring data every 6 months. Now we get extremely accurate monitoring data every 3 months. And the cases have gone down because of that. Now we're in very tough countries, so even the measurement system doesn't guarantee that we can overcome the violence. There's a challenge of communications and reaching out so that people are not misled about the vaccine being good for their children and the way to end the disease.